Recently, the House of Representatives proposed the Medical Workers Retention Bill to check medical workers from seeking greener pastures within 5 years of employment. What does this mean for the profession and how do we change the narrative? This and more on Sound Health this week. Good evening, I am Olasumbo Modupe. It's so good to have you on the show. The conversation begins after this break. Please stay tuned.
The WHO Constitution, which entered into force in April 1948, affirmed health as a fundamental human right and established a clear vision, highest possible level of health for all people. That mission is as relevant as ever. 75 years since the founding of WHO and 7.5 years to the 2030 deadline for the SDGs, we know it can only be achieved with an adequate and well-supported health workforce. COVID-19 has given the world a new appreciation for the incredible value of health workers. First, we call on all countries to protect all health and care workers from violence and discrimination, to protect their labor rights, and to protect them with safe and decent working conditions. Second, we call on all countries to invest in health and care workers, specifically in decent working conditions, fair pay, and training and leadership. To address shortages, we must address the supply issue by learning from each other about how to develop and implement innovative models of education. Investments in education must be matched to jobs and careers with the right salaries and incentives.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Olawale Oladubu, a family physician and national auditor, Healthcare Providers Association of Nigeria, and he is going to share his expertise and thoughts on the Medical Workers Retention Bill. Good evening, Dr. Oladubu, and thanks for joining us.
Good evening, Lagos. Thank you, LTV, for having me.
You're welcome, sir. Sir, about 85% of resident doctors are willing to leave the country seeking greener pastures. What are you concerned about these developments in the country, in the medical world?
Yeah, very well. Every patriotic Nigerian should be concerned, and as a professional, I'm also concerned, and I can also say that the entire healthcare community in Nigeria is very much concerned. It's a trend that needs to be up, and by addressing, the remote and immediate causes of this new trend. And I think government has a lot to do in this regard.
Okay, before we look at how to address the situation, the vacuum created by these developments, what are the causes? Why would an average Nigerian or a medical doctor would want to seek greener pastures after getting his license to practice here in Nigeria?
Okay, thank you. Well, it may be a misconstruction if you think that maybe the only reason why a doctor would want to go overseas or abroad is to seek greener pastures. Human beings generally seek fulfillment, in every process of life, and as professionals, you also want to have what we call job satisfaction and career fulfillment. And I think this is the basis, for this new trend. People want to, for instance, the joy of any doctor is to see the patient get well. Every health worker wants to contribute their own quota and make sure that their impact is positively felt by the population. So, and if this is not achieved, nobody would be happy. So, as I said, as healthcare professionals and doctors, you want to see that your patient gets well. But when you are being handicapped, to exercise this, to have this fulfillment, then you want to speak to that elsewhere. So, for instance, the infrastructures are not there, the equipment are not there. Even when you are the professional, you have that intellectual capacity, you have that the wherewithal as an individual to contribute your own quota. But when you are being restrained, by lack of amenities, lack of equipment, then you don't get that fulfillment. So economic reasons may just be the secondary, but the main reason is when people are unable to exercise, their capacity to the fullest as professionals.
All right, in a bid to check the brain drain syndrome, the House of Representatives initiated a recruitment policy. What does this policy entail, and what does this mean for the medical world now, the profession?
Okay, well, for me, first and foremost, I would want to appreciate the fact that the legislative arm are able to identify that there is a problem, and they are also trying to mitigate, against this problem. So to that extent, I think it is commendable that yes, we know there is a problem and we are trying to solve it. So, however, the way and manner of doing this is another ballgame entirely, and then that is should be subjected, to critical analysis. And I think that is what we are going to look at now. For instance, why government thinks they should have control is because they also feel that they have contributed to the training, of these professionals. So as we know that tertiary education in Nigeria is highly subsidized, or if not even for free, compared to the same standard of education elsewhere in the world. So we know how much people pay to get a medical training or to even get higher education qualification at all. So in Nigeria, I can say that it is highly subsidized by government. So government may now feel that, okay, if the country has, invested so much in training these professionals, then it is only proper for these professionals to also pay back, to the society before they leave. And I think that is the basis of that, the basis, for the proposal that is on ground. Way of to say that to that extent, yes, the bill may be germane. However, we must also note that we cannot change, the goalposts after the game has started. So we cannot train professionals, just for instance, it's like you throwing a party and asking you to come to eat in your party. And after eating, you now close so that they have to pay for the year. So if there is no such agreement at the issue, then we cannot now, in the middle of the game, begin to ask professionals that no, they cannot go, you have to sign a bond and all of that. If that has to come in place, it must have been before their training, and then they must have also decided, excuse me, they must have also decided whether they want to go into such training and then have that bond or not. And then it's also not every Nigerian that also had their own training with public institutions. There are some who actually paid the cost for their training. So especially those who went to private universities and all of that. So you cannot put all of them into the same mix, So if I have paid the price for my education, the government has no right to tell me how I also do my practice. Then at the end of the day, would this even, if this is even the case, then will it address the situation? I want to tell you that it will even worsen the situation than what we have now, because now we have people who show interest in medical training, healthcare training, and then if you now say, yes, you have to stay for another 5 years after your training, then what we now have, the resultant effect will now be that people will be discouraged from even going into the training, from the word go. So, because if you say, take for instance, somebody who has gone to medical school training takes average of 67 years, and you're now saying that before you become a full professional, then you have to spend another extra 5 years, so making it 12 years. So somebody will tell you that, okay, am I ready to spend 12 years to get my first degree or to become a full professional? So that may be a disincentive. And at the end of the day, you now have less people showing interest when they can go to some other fields, spend 3 years, 4 years, and become full-fledged professional. So what I'm saying is that it will even deepen the crisis than what we have now.
Policy targeted at just doctors or all health workers?
Yes, well, as far as I know, I think it's something that is targeted, for now, restricted to doctors. But again, to understand that you cannot just limit it to doctors, or if you do that, you still not get the right mix of health professionals that you also need to do the job. Because there is this a recommended ratio, of doctors to a given population. There's a ratio of the health workforce mix, doctors, pharmacists, nurses, medical laboratory scientists, physiotherapists, and what have you. So if at the end of the day, because this brain drain you are talking about is not just limited to doctors, it's something that cuts across, even beyond the healthcare industry. So if you now restrict to only doctors and you retain doctors and other health professionals that will also support, the healthcare delivery, also not there, then we still wouldn't have achieved anything. So if you are looking at this, then it should be looked at holistically, because as doctors are leaving, I can tell you, categorically that we have even more nurses that are leaving. We have medical laboratory scientists that are also leaving. So at the end of the day, yes, we have, if this bill sails through, then yes, we might have improved doctors' retention in the country. But what about other health workers that are also needed to salvage the poor health index of the nation?
All right, Dr. Oladubu, thanks for that clarification. Following this development in Nigeria, the World Health Organization has also directed the UK government to restrict or put on red list Nigerian trained doctors. Do you see this working? Do you see these measures working for the health support system in Nigeria?
Well, yes and no. We know that the port of destination for many of our doctors or health workers in the UK, the US, Canada, Australia, and the like. So, but then there are several other countries too who are who are also fertile grounds and who have also opened their arms to receive Nigerian doctors and healthcare professionals. So UK is just one of so many countries. So if UK is putting that restriction, then it's only giving a better chance to other countries too. I can tell you for free that Saudi Arabia, Kuwait, especially those countries in the Middle East, UAE, they are also fertile grounds, to receiving Nigerian trained medical doctors. So UK is just one of the countries. So if UK is putting that red flag or that restriction, it may still not really go far in copying this. So it will only shift the attention of such Nigerian trained doctors to other countries.
All right, what should the government be doing differently now? We have also seen some people argue that some doctors, some colleagues have argued that people should not, their colleagues or other practitioners should not relocate or seek greener pastures. Do you buy into this idea? Do you support this school of thought?
Yes, things that government should be doing, because I also tell some of my colleagues that, well, of course, all of us cannot leave, not because we do not want to leave, but then if every doctor leaves, then who will attend, to the remaining population? Even the doctors who are left, they still have their relatives here, and some doctors will also need to attend to them when they need medical services. So, having said that, I think government should rather look inwards. Number one, advocacy, doing conscientizing our professionals, give them new orientation, is key. Then number two is that they should look at why are our professionals leaving the country in the first instance, and then let them reverse that trend. So, as I said, economic reasons may be the one of them, but it's not top on the list. So, if professionals are looking for job satisfaction, they are looking for a good working environment, they are looking for equipment to work with, then government should address that, So, rather than thinking of policies, it's not everything that can be legislated, and this is one of them. We can really legislate, people to stay put, because it's also against the fundamental human rights of individuals and citizens. So I want to say that government should rather reverse, the trend of why people are living. And as I said, people want a good working environment. People need our health care space, to be well equipped. We want the latest technology, it will also apply in what we are doing. So we don't want to be 18th century doctors, you understand? So, and the only thing that will make the difference, apart from the training that we get, are the equipment and the technology that are at our disposal to work with. And the government is able to do this, the local balance, we call it Japa syndrome, and I can assure you that we begin to see our colleagues, Japa back to the country.
Okay, Dr. Oladubu, your call to action as we wrap up now, especially now that the resident doctors just called off another batch of strike.
Yes, I didn't get that. Can you repeat it?
I said your call to action now, especially now that the resident doctors just called off another edition of strike.
Yes. Well, it is the right of the doctors to strike if they feel that the government is not listening. And as you know, that the only language Nigerian government listens to is industrial action like this. However, I would still say that the health indices in the country is very, very abysmal, and the strike will only worsen, the situation. So I want to appeal to my colleagues as well. Let us still exhaust every means of communication and interaction, with government to solving, this unpalatable situation that we have on our hands. So, what strike as good as it is, I would say that it should be made a means or a last resort in this regard.
Okay, if I were to ask you, would you travel if you have the opportunity? Would you also seek greener pastures if you have the opportunity to do that on a platter of gold?
Mm-hmm. Well, I'll tell you that I've always had the opportunity. And I still go for exchange programs abroad. I also visit facilities abroad, and I'm still here today. So, and that tells you that, as I said, no matter how interesting and palatable it is, not every doctor will do it.
All right, Dr. Olawale Oladubu, thank you so much for your time and expertise. And I hope that your junior colleagues have learned one or two things. They can always seek greener pastures, get more skills, equip themselves, but they should always have it at the back of their minds to always come back home. There's no place like home. Dr. Olawale Oladubu, family physician and National Auditor, Healthcare Providers Association of Nigeria. Thank you so much for your expertise and thoughts on the Medical Workers Retention Bill.
Thank you very much. Thank you.
All right, Soundhealth continues with trending health report from around the world. Please stay tuned. Well, this is where we say thank you on today's episode of Sound Health. We all owe Nigeria the responsibility. Let's remain patriotic. Nigeria will be better again. Nigeria will rise again. For comments and inquiries, please send SMS to 035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.